And now we're going to look and saying, well, what happens and what can we do perhaps if our communication is impaired in our delivery, so our speech and our voice. As a speech-language pathologist myself, we work with a variety of different clients in a variety of different locations. So I'm going to just kind of look here as the scope of our field. We do work with children, even in neonatal units. We may be working with babies with feeding issues. Commonly in our training program, we have speech-language pathologists that are transitioning out into the school districts and providing speech therapy to children in the schools and preschools. And then we have another position of our field, or portion of our scope of practice, where our trainees and our speech-language pathologists are going to work into hospitals, perhaps private practices, doing outpatient therapy, very often in skilled nursing facilities, working with adults perhaps that have changes in communication, or even changes in their ability to swallow, as well as home health agencies, and then as we have our university. So we're working in a training facility within the university. Conditions in adults in particular that we commonly see as speech-language pathologists are going to be adult language disorders. So that's conditions like aphasia, which occurs after a stroke, and is that a difficulty in finding the words, connecting the words within the brain, where there's actually been brain damage in the areas of the brain related to language. And then dementia as a progressive condition where that ability to communicate, find words, be planning, executive function skills, they often will begin to decline. So we're working both on that language aspects, but sometimes with our dementia clients, we begin working with aspects of sequencing activities, working on attention, problem-solving skills, and daily activities. We also work with fluency disorders, motor speech disorders, maybe things related to dysarthria or an apraxia, so weakness within the muscles of the communication system, maybe weakness in the tongue, weakness in the lips that then changes that ability of how you're able to articulate. Voice disorders, which we'll talk about today. And then we have an area of our field which we term augmentative and alternative communication, which is really how we can help support those with alternative means to be able to communicate. Sometimes it is a device that may be able to speak for someone when they aren't able to speak. It can also be as simple as just a board, maybe with some topics, where somebody will point to a particular topic to frame a conversation and help improve that communication exchange. And I'll provide some examples of kind of what those look like and when they might be used. So as being a therapist, whether you're a speech therapist, occupational therapist, audiologist, we want to look not only at the problem, but how then it begins to affect that individual. This is a international classification of functioning and disability, and it's just a framework from which is a best practice for us to be able to treat our individual clients. We don't want to just treat what would be the body and function. So let's say, and we'll go through and talk about how there's physical changes to the voice as we age. We may go in and address some of those physical changes, but we also want to work with our clients and learn how that is affecting their daily activities and their participation, and how maybe inability to project one's voice means that they no longer go out to eat in a noisy environment. So it begins to affect quality of life measures. And I think as speech-language pathologists, we look at our clients very holistically and say, what are the markers, what is important, and how can we help facilitate change and create motivation? So the process of speech, I like this quote, and it kind of ties into what Dr. Sheikh was mentioning about these essential components of life and quality of life. Here it says, speech is perhaps the most sophisticated example of a species-wide movement capability in the animal kingdom, requiring split-second sequencing of approximately 100 muscles in the respiratory, laryngeal, and oral movement systems. It's amazing, our ability to speak. It's not only our thoughts that we're able to develop, but how our whole system is able to coordinate itself with all of these muscles in split-second timing to make the variety of sounds that we need to say, to make the words to complete our thoughts. So if we break down the process of speech It really comes down to 4 processes. We're going to have our respiration, we'll have phonation, articulation, and resonance. And it's the balance of the muscles and the coordination of those muscles within these 4 areas that create speech. So if we start with respiration, we have our diaphragm, which is our primary muscles for speech. Our diaphragm sits just below our lungs, connected to our lungs. It's kind of like an upside-down bowl. And when it contracts, it lowers. And when that lowers, it expands our lungs and creates greater volume within our lungs, which then has a negative pressure and air rushes in. It's the kind of the fuel for our speech, like it's fuel for a car. Then when we begin to speak, that our diaphragm relaxes and begins to bow back up, and that air then comes up through our lungs, and it's going to pass over our vocal cords in the larynx. And with our vocal cords, there are 2 tiny, tiny muscles within our voice box. They're positioned on males, which would have a predominant Adam's apple. That is our thyroid cartilage, and it's kind of a protective mechanism for our vocal cords, and they're located perpendicular right behind that notch there. And that air comes up, it's going to pass over this area, and when it does, our vocal cords come together and they vibrate. And they make a sound wave similar to what would happen if you if you plucked a string on a guitar. It's going to create a sound wave that'll then travel and resonate through that guitar. And vocal cords, they're going to open and close. So they're open when we breathe in, and then they close when they begin to vibrate. And then they stretch and they contract. So as they stretch and they get longer, our pitch goes up. And as they contract, then the pitch goes down. So it's a very delicate balance between this air passing up and the coordination of the timing of the air hitting our vocal cords and then creating that sound wave. And then that sound wave is going to travel up through our pharynx and our nasal cavity and our oral cavity, and it's going to shape that sound, creates that sound at a particular pitch, but every one of you has a very distinct quality of your voice. So that when you call somebody, they say, "Oh, hi, Mark," and they already know it's you, or you know it's your children, or you know it's your mother or your husband on the phone, because of that kind of imprint of the resonance of our voice. Because the pitch is just the marker. You could speak at the same exact pitch as you, but you would have very distinct different qualities of your voice. Just as James Earl Jones has a very rich, resonant voice, you can have other people that have a very nasally kind of voice, maybe like a Gilbert Godfrey. You know, you can change the quality of your voice and have it be very resonant in the nasal cavity, and it's not always that pleasant sounding, but man, can that sound carry. We know some of those people that are the loud talkers, and they tend to have a voice that can carry across the room. That has to do with the balance of the resonance, and it's creating overtones and increasing the richness of that sound. And then we have articulation. So that is that coordination, what we typically think of for speech. It's kind of the end result. It's all the movement of your tongue and your jaw and your lips and even the shape of your cheeks that shape the sound. So whether you're making a k with your soft palate and the back of your tongue, and then you move to the front and you say p, and it's a simple sound with your lips, but we coordinate all of this in a rapid sequence to where we're making hundreds of these movements and sounds in a very short period of time. So it's a delicate system, so when it's shifted off balance in any one of these areas, it will create a reliance of the other areas to support. So if somebody has maybe impaired resonance because the soft palate isn't quite as strong, they have nasality, they're losing air through their nose, they're going to have to rely more strongly on their respiration. They're going to have to get better breath support to compensate for that loss in a different area. So they all kind of balance within one another, and that's where we can work as therapists to say, okay, we recognize an impairment in one area, how can we maximize all of these other areas to help maintain that communication? So I'm going to work through each of those basic areas, respiration, phonation, resonance, and articulation, and talk about the changes that you may experience naturally with aging and some of the other conditions that are frequently seen in an aging population and have impacts on speech and voice. So first, looking at respiration, something we do hundreds of times every day without any thought, but we can have weakening of respiratory muscles. It's maybe related to use of cigarettes or other environmental conditions of exposure that have maybe caused some lung damage. It can also be about use of how much you're using those muscles. As with anything, if we don't use it, we lose it. So if we think about our respiratory capacity, and when you guys are sitting there, you're not speaking, you kind of have an idle respiration, that you're moving just slightly in and out and only activating that diaphragm and those muscles within your rib cage slightly. And then when you go to speak, you're going to exercise them and expand them even more because you're going to need more air to fuel that sound. And then if I was to say, I want you to take a deep breath and I want you to maximize your respiratory capacity, you kind of feel that pressure within your lungs. So let's do that. I want everyone to take a nice deep breath right now. And then we're going to exhale. And we want to think about where we're taking that breath and where we feel the movement. Are we feeling a lot of movement in our chest, here, and in our shoulders? Kind of a Tarzan breath when you take a breath and you go, ah, you kind of feel a lot of tension here. Or are you feeling that there's a lot of abdominal movement? Is that diaphragm lowering? When it lowers, we have to make some space. We're going to feel an expansion within our abdominals, and then you're going to have that good abdominal movement. So I want you to try it again. I want you to think about where that breath is seated. Is it seated in our shoulders, in our chest, or in our abdominals? So when we take these deep breaths, you're stretching those muscles, you're activating those muscles. It's kind of like range of motion for the muscles of breathing. And I think it sounded like you guys had somebody last week that was speaking about exercise. Is that it? And kind of conditioning aspects. And there are things that we can do just even on breathing that can help us do range of motion and help increase the strength and coordination of those muscles. We also, in aging, see a decrease in measures of lung function, vital capacity, the whole air. So if you're to take a deep breath in and blow all of that air out, we can actually calculate it in liters of how much air was within your lungs. How much are you able to, how large is your lung capacity compared to yours or compared to an average? So there are studies that show that as we age, we see a decline in our vital capacity. And what that leads to is we have less gas exchange. We're not moving that carbon dioxide out of our systems. We're not oxygenating as much as maybe we could. And with that, we have decreased defenses. They see that as we have decreased vital capacity, you can have an increase in illness. It reduces your defense mechanisms. And as well as maybe the more obvious that you would think of is that effort to breathe, shortness of breath that some may experience. So it's a very important component of our daily life that we, I think, often may take for granted. So how to decrease the effects of aging on the lungs? So one, don't smoke. Practice optimal breathing. So as you guys were kind of considering where that placement of breath is, that's something to think about, and maybe even practicing a few minutes a day. It's kind of a little bit of the foundational aspects of a lot of meditation practices is making sure that you're doing circulatory and deep breathing because it's good for your body. Practice physical exercise. So as I was doing those comparisons of saying, here's your lung movement when you're seated, here's your lung movement when you're speaking, here's when we take a deep breath. Exercise also. We take deep breaths when we exercise. We're actively using those muscles. So exercise is great for your entire body as well as your respiratory system and keeping you healthy. And they also have now these respiratory trainers that are getting used more frequently. They're used in a lot of conditioning for exercise, but they're also beginning to use them frequently in skilled nursing facilities where people may be having difficulty with swallowing or difficulty with their breathing. It's resistance. So you're blowing and breathing into a tube that has resistance that'll help exercise those muscles. And moving on to voice. So as that air comes up, then it's going to hit those vocal cords. Vocal fold atrophy is really the most common condition in aging. We have these two vocal cords that are fine, these fine muscles, and they will begin to weaken and have less bulk to the muscle, and what happens is they begin to bow. So instead of those vocal cords coming together and vibrating and making a nice clean sound and having a lot of contact, they come together, but they come together kind of weak. And with that, there's going to be a lot of air that passes. So the voice may become breathy, it may become hoarse, and just an overall weak-sounding voice. This is the situation that Chancellor Hinshaw had described, that I had the gentleman that came, and I was working with, excuse me, that was 92 years old, and he was a docent at the Air Force Museum. He was a widower. He did not speak at home. This was the one time of the week that he got to go out and engage in the community. He was the final remaining Air Force attendee there that had been in Honolulu at the time of World War II and the Pearl Harbor attack. So he was a very important resource of information, but he was losing his voice and ability to be able to connect out with the groups. And part of it was that he was at home and he was quiet all week long, and he never exercised these muscles. So we tend to talk less as we get older for maybe a variety of different reasons, but then we're not exercising our voice. So we worked with him on some exercises, which we'll share some of them with you today, on how to kind of bulk up that vocal cords and make it so he had good closure, and he could then project more loudly and maintain his voice and was able to continue doing his work. Other things that happen as they're happening throughout the body is going to be ossifications, the cartilages and joints, and then that relationship of decreased breath support. So if we have less breath support, what often happens is we squeeze and we'll push from our voice. Instead of that air kind of projecting for us, we'll squeeze within the laryngeal muscles, and it can create a lot of strained sound in a voice. So this is a visual. Here are the vocal cords. So this is if we were looking straight down on top of our throat. So here are vocal cords from a normal larynx. They would kind of open and close right here, but this is as they would be together for speaking or singing. So they come together and they vibrate. And here's a picture of an aging larynx, an older larynx, and this is that vocal fold bowing. So you can see instead of those vocal cords coming together in a nice clean line, that they have an airway that is still exposed. And this one is a little bit more deteriorated than this one. So one, when that air passes, a lot of air is going to escape and create a breathy quality. And then this vocal cord is going to vibrate at a different rate than this one. They're no longer even. So when that happens and you have variability, it'll cause hoarseness in the voice. So it's actually creating two tones that are then passing through. So those are those qualities that you might experience or hear in others, hear in yourself. Often we pick up the changes in our voice. It's our personal imprint, maybe before others. So changes in voice quality may be that it's soft and weak, hoarseness, shaky, breathy, and then altered pitch. We naturally have changes in pitch as we age. And interestingly enough, female pitches decrease and male pitches increase. So it's an inverse relationship. So what can we do with our voice to help keep it strong? It's such it's what manages us to be able to communicate. One is talk. Be social. Talk with other people. Think of it as exercise when you're talking. Or maybe sing. Singing in choirs, you're exercising, you're using different pitches within your voice. It's good practice for your voice. There's even groups now, and we'll talk a little bit about Parkinson's in particular and how Parkinson's affects voice. But there are some singing groups specifically for individuals with Parkinson's because it's a nice social opportunity for them to talk and also be able to get some exercise. Use those abdominal muscles to support the voice. We want to make sure if we are speaking without good airflow, my analogy is you have a balloon filled up and then you only let a little bit of air out and it goes, So if I talk on just a little bit of airflow, it's going to really change the quality of my voice. It's going to be very strained quality. So you want to have that balance between your airflow and then as it's passing over the vocal cords. Stay hydrated. There's a thin mucosa that covers the vocal cords. If you have irritants, particularly like reflux, that can become very thick and harder to manage. It's there as a protective to protect the muscles and protect the lungs, but we want to make sure for optimally, we want to keep that clear. Because what happens when you have buildup? We cough. And what do we do when we cough? We slam those poor vocal cords together really abruptly. And it can lead to other issues of growths on the vocal cords. You know, if you have a cold, you'll also notice I was coughing a lot, and then my voice got deep and changed, and then maybe I wasn't able to speak at all. So it can become a cycle sometimes with coughing and allergies and other conditions. And then watch out for reflux and things like chronic cough, as I'm saying. It can become a vicious cycle, but staying hydrated, working with that abdominal breathing can be very effective. So we're going to do just a couple exercises. These are some of the exercises that we worked with that one gentleman who was 92. So we want to look at what we would term induction exercises. So we want to make sure that we're doing a little extra force to make sure even if those vocal folds were slightly bowed, we're going to try to push them together. So we're getting a nice clean sound. And we're going to kind of begin to feel in this one that velving of the vocal cords at that point right behind our thyroid cartilage or that Adam's apple. So what I want you to do is while you're seated, I want you to hold your breath as tightly as possible. We're not holding our breath with our lips being the pressure. I want you to think about holding it with your vocal cords closing. So your mouth could be open. And while you're doing that, I want you to push down with your chair for 5 seconds, and it's going to kind of help give extra effort and pressure onto all of those extrinsic muscles that engage into the larynx. So take a deep breath in, and then push down and hold. And release. You probably are increased that you can really hold your breath quite a bit right there at your larynx. So it's a good exercise. If there was any bowing that was happening, it would be a lot harder. You'd feel that, like there's a release out of it. So that adduction, that pushing down, you can also do it if pushing down is uncomfortable, things like pushing together with your hands or using a therapy band, if any of you have one, maybe from physical therapy, that can be another way to help kind of engage extrinsic muscles that surround the larynx that can then help adduct those muscles on the inside of the larynx. Then similarly from that, now we're going to do the same thing, except we're going to do a nice loud ah while we do it. So we're going to take a deep breath in, and then we're going to push down on that chair and go ah, and try to keep it going as long as you can. We'll see who's got the most hot air. Oh, Shirley was one of them. There was somebody else in the back too, but good. So that seems relatively simple, but it can be very effective when done in repetition. It is exercise for your voice. So for some people, 5, 10, 15 trials might be enough. For other people, they need more. The point is to do it until you feel like you've taxed your system. Just like exercise, going out and walking, some individuals are going to be able to walk longer than others until it becomes a good exercise benefit to the system. So I think the point is to do it until you would start to feel like, wow, I feel a workout within my lungs and my larynx. This is another one. I'll let you guys try this one at home, but it's similar in that you're just going to separate that air and go ah, 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 and try to kind of pop it out. So part of my homework for you guys this week is to do some of the breathing and the laryngeal exercises. You can share them with your family and maybe your neighbors. So other voice conditions. So we talked about the presbyophonia, so that's when the voice just has the atrophy on the vocal cords. Other conditions, most commonly that I see and we see at the clinic, is Parkinson's disease. Parkinson's has an effect that's really unique onto the voice itself. I saw a gentleman actually yesterday that I evaluated that has Parkinson's. We did vital capacity testing on him. He was within normal limits for his vital capacity. We did testing on his oral structures. They were all within normal and functional limits, but he spoke like this almost the entire time. And his vocal cords were not coming together. And it's not a matter of function or like that there's a pathology or lack of innervation. It's that slow, insidious process of Parkinson's where over the years you gradually have put less effort kind of towards and engagement into the muscles of speaking. So as that happens, they begin to speak more softly with less adduction of those vocal cords together. The great thing is that this is one of the conditions amongst these neurological conditions that we've really shown that we can really treat. So we work with them on the amount of respiratory effort and kind of pressure within their laryngeal function and their larynx that's able to help drastically improve their volume. And it's a really rewarding, it's some of the things that I love to do the most because these individuals that have Parkinson's have had a slow progression of losing ability. And to, at this point, be able to work with them and give them something back as valuable as communication, it's a really rewarding experience. And I do have another video to share I think on the next slide. Some other conditions that affect voice are some neurological conditions like ALS and MS. ALS affects the respiratory drive, which then affects the voice. This isn't a condition that we have therapy to help. We start looking less at rehabilitative aspects and more at what are those supportive aspects. How can we maintain the essential communication for these individuals so they can still communicate with family members, communicate with doctors, have their emotional needs met as well as their basic activities of daily living. Similarly with MS, there isn't a lot of effective treatment. It kind of depends on the individual, and we may look at some of those other alternative communication methods to help support their communication rather than rehabilitate it. Other conditions such as stroke and traumatic brain injury, depending on the severity and the site, may cause some changes in voice, but more predominantly changes in speech. And then surgical nerve damage with the vagus nerve. Sometimes if you are having heart surgery or maybe shoulder surgery, there can be effects if that particular nerve is affected during surgery. It can affect the voice as well. So this is the video example from the Lee Silverman voice therapy. This is a treatment that's been developed specifically for individuals with Parkinson's, for those quiet, that reduction of volume with the voice that is seen. It's a pre and post-treatment video, so you can kind of listen to the individual's quality, this lady's quality of voice before and then after 8 weeks of therapy.
Understand what you said.
Right. No excuses, right?
Yeah, no excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
So she's a great example, and what I like about this video is not only that she can hold that off forever, but is what you see within her face and her aura, kind of. You see somebody previously that was withdrawn, not having effective communication with family members, had almost that kind of depressed look about her, to then that flip side when, yes, we're increasing her voice, but that the effects of her being able to communicate effectively, then it is a huge impact on her quality of life and her well-being. So then we have changes in speech and resonance. Typically with aging, we don't see as much changes just with natural aging. If we have changes in speech and resonance, they're more likely due to effects of a stroke or another condition that is going to cause either some weakness, as we see in like a dysarthria, or an apraxia where we have impaired coordination. With this, if it's a period post-stroke, we work with individuals on oral exercises similar to like physical therapy for those articulators, but long-term, often there are still residual effects of a distortion of speech. So as we said, common changes in speech and resonance, and then symptoms. I'm going to buzz ahead just a little bit for time. So we would look at strength and coordination training with individuals that have impaired speech and resonance. We may recommend in these individuals, because they may not get back to typical functioning prior to a stroke or prior, and we want to help support them. So similar, you'll see a lot of these are the same that Dr. Sheikh had on his with how to help facilitate communication for individuals with hearing loss. Same thing. So we want to modify the environment. We want to consider the lighting, the distance to the speaker, background noise. We want to attend to the listener so we can look for that visual cues. How can we control our environment to stage the most optimal communication exchange? Looking at topic maintenance, identifying a topic. It's much, if we can say, let's talk about dinner, and I start going off talking about, macaroni and cheese and all these other things, then if you don't have context, that listener is doing a lot of extra work to try to piece together what you're saying. Use of gestures, and then also for some individuals, timing important communication exchanges. A fatigue factor in a lot of conditions, particularly something like ALS, an individual may fatigue throughout the day, so they may want to think about energy conservation and timing important communication exchanges early in the morning or perhaps after a nap. So my last couple of slides kind of are on assisted communication. So if there is still a residual impairment and decreased in intelligibility, what can we do to help individuals communicate and maintain that communication? So there's a lot of low-tech options that are just simple pieces of paper. This is called an alpha core board. It has all of the most frequently used words in the English language. A lot of times there are words like this, was, were, a, after, all, and they can build sentences by pointing to each of these words. And it's a pretty quick and effective way to build sentence-level communication without having to spell out. If you had said I, W-A-N-T, T-O, G-O, it's exhausting. So it can help facilitate the speed of that communication. Things like picture books, other communication boards, as well as we have high-tech options now. There's a number of iPad applications that are functional for self-generating speech or text-generated speech, as well as some dedicated systems. Here's a couple more of those low-tech options. This is commonly used in hospitals. That's a hospital board. It'll have things related more like I want to see my doctor, my nurse. People have temporary or long-term communication difficulties, these are frequently used. This is an example of a topic board where if we say I want to talk about what something is used for or how I'm feeling, it can help frame that there. But it's pretty remarkable what we're able to work with now. They even have this now where they do voice banking. As people are diagnosed, maybe newly diagnosed, they haven't yet experienced changes in their voice, maybe they're experiencing changes within their gait or their hands, but they have their voice preserved. They can actually go through a series of programming to where they can develop that digitized voice, that output voice, to be their own voice. And they can preserve their voice in that way and keep that, as you were saying, it's kind of like a thumbprint of what your voice is. And some people have a hard time pairing to that mechanical voice and kind of identifying with it. So it's a way to be able to kind of bank your voice and be able to continue. So when in the future, he's going to press that, it would be within the voice that he had before the decline happened. So your exercises is practice breathing and voice exercises. Going through that list, if you think about the lady in the video that said she did her highs, her lows, and her ahs every day, you guys are going to do some breathing and some ahs this week. So you can reflect back on those exercises were there and kind of build some more awareness. And those are references, so thank you.